Good morning, everyone. There is a light at the end of the tunnel. Through painstaking work and collaboration, Western pharmaceutical companies have managed to produce safe and effective vaccines in record time. Access to vaccines will help jumpstart our economy and ensure that Main Street can finally start breathing a sigh of relief. Plusieurs pays voient enfin le bout du tunnel. Des vaccins ont été développés dans un temps record et de nombreux pays ont préparé un plan de vaccination. The United States is planning to have 100 million people vaccinated by the end of February, and its entire population vaccinated by June. The United Kingdom is starting their vaccinations next week, and France is rolling out a national vaccine plan for most of their country between April and June. But Canada is nowhere to be seen. Just this past week, the Prime Minister and two of his senior ministers were proud to announce a vaccine deployment date. The problem? They were each confidently talking about different dates. These mixed signals from the very top of the federal government have real-world implications, both for the rollout of the vaccine and for the well-being of Canadians. Let me be clear. We know the end game. While our neighbors to the south will be revving up their economy again, Canadians will be told to keep waiting. While restaurants across Europe spring back to life, Canadian businesses will be told to get on the CERB or bust. And while seniors in the UK will be free to see their grandchildren again, Canadian families will have to continue to see theirs through Zoom or FaceTime. Justin Trudeau has set September as a possible vaccination objective. Just think about that. 10 more months of business closures, of limitations, rising mental health issues, domestic violence, drug abuse. We all have learned the tragic costs of a shuttered economy. Alors que des pays entiers vont sortir du confinement, les Canadiens vont les regarder avec incompréhension. Pourquoi sommes-nous si en retard? Il y aura de l'incertitude au Canada. Notre économie va continuer à souffrir alors que nos voisins vont repartir en force. Et surtout, des Canadiens vont devoir continuer à accompagner leur famille à l'hôpital et craindre pour leur santé. C'est profondément injuste. Pourquoi en sommes-nous là? This is unacceptable. Why are we so late? What happened? Simply put, incompetence. After all, we know about Communist China. In the spring, when journalists and the opposition challenged the Liberals on China's data, they accused us of spreading misinformation. All of our issues were factual, and all have been confirmed. Now they are doing this again when we challenge them on the failed CanSino deal and their confused and delayed information on vaccines. This incompetence is alarming. But their denial and redirection is even more concerning. As was to be expected, Chinese officials likely benefited from early Canadian advances in vaccine research. And when the time came to ship samples to Canada, China broke off relations. After months of putting all of our eggs in the China basket, the government was left out to dry. And then, after this catastrophe, the government still took its time. When this government scrambled to catch up after their joint venture with China failed, it was already too late. Ce gouvernement a été naïf, et tous les Canadiens en payant le prix aujourd'hui. Justin Trudeau insiste pour travailler avec la Chine, alors que nous savons tous que ce pays ne veut pas notre bien. Le résultat est que vous et votre famille n'aurez pas un vaccin avant 10 longs mois. Sans un plan pour les vaccins, nos entreprises n'auront pas la confiance de réinvestir dans l'économie. Et la frontière avec les États-Unis risque de rester fermée à cause de l'incompétence des libéraux. Canada now finds itself delayed and behind most other G7 countries and nations with a total population of 2.7 billion people. Will all of these people receive vaccines before all of Canada has the opportunity? In the G20, Canada seems to be the only one with no clear plan for vaccine distribution. Without a concrete timeline for vaccines, businesses won't have the confidence to reinvest in their operations, to rehire Canadians who've been laid off during the pandemic. Without a reliable timeline or details, provinces have the impossible task of establishing complex supply chains with no lead time, without knowing when they can expect a vaccine delivery. Simply put, Canada still has no plan for receiving and distributing a vaccine. And without a plan for vaccines, there is no plan to fully reopen the economy. Justin Trudeau and his government has failed, and he's setting up the provinces to fail too, through his China delays, secrecy, and incompetence. Today, the Conservatives are putting forward an important motion because Canadians deserve certainty, clarity, and competence. Notre parti présente une motion qui va demander de la clarté et un plan à ce gouvernement. Il est temps de protéger les Canadiens. We are asking the Liberals to put the health and safety of Canadians first by sharing how each type of vaccine will be safely delivered to Canada, stored, and distributed. Canadians deserve to know the date on which each vaccine type will first be deployed in Canada and the rate of vaccinations anticipated by month. As for a plan, provinces and health partners across the country need to know any intended federal guidance with respect to the deployment of the vaccine by priority group, such as frontline health workers and seniors. Canadians deserve to know the plan for the distribution of vaccine to Indigenous Canadians, members of the Canadian Armed Forces and their families, and veterans, each of which fall under federal health jurisdiction. This is common sense. In the middle of this historic health crisis, this government should not be operating behind closed doors. Before Christmas, Canadians deserve the hope that will come with a plan to roll out a vaccine to help us turn the corner in COVID-19 in the new year. Thank you. Merci beaucoup.
We'll now take questions, starting with questions on the phone. Quick reminder, one question, one follow-up. Nous allons maintenant prendre les questions. Donc, commençons par les questions au téléphone. Un petit rappel, une question suivie par journaliste. Today we were allocated time for 6 questions total. Aujourd'hui, nous avons le temps pour 6 questions au total. Operator, do we have a first question?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour toute question. La première question, the first question is from Lina Dib, La Presse canadienne. Please go ahead, your line is open. Votre ligne est ouverte.
Bonjour, M. O'Toole. Je voudrais savoir, votre motion demande un plan avant le 16 décembre. Jusqu'à maintenant, le gouvernement, la seule information qu'il nous donne, c'est 6 millions de doses entre janvier et mars. S'il n'a pas plus d'informations que ça des compagnies avec lesquelles il a fourni des contrats, il a signé des contrats, vous vous attendez à voir quoi le 16 décembre, qui est dans, je ne sais pas, moins de 2 semaines?
Merci pour la question. Les Canadiens ont besoin d'un plan avant Noël pour le vaccin. Un plan avec des détails, particulièrement pour nos communautés autochtones, les forces armées canadiennes et nos vétérans, les 3 enjeux dans la juridiction fédérale. On a besoin d'une timeline pour chaque vaccin et un plan pour la distribution par province. Il n'y a pas un plan maintenant. Et nos forces armées canadiennes ont besoin d'un plan aussi pour leur mission d'aider le gouvernement avec le vaccin.
D'accord. Alors, je comprends que vous voulez un plan. Ce que je ne comprends pas, c'est comment est-ce que vous attendez à avoir des réponses si le gouvernement lui-même n'a pas des dates précises des compagnies qui vont fournir les doses. Et puis, peut-être que vous voulez élaborer là-dessus, mais dans un autre ordre d'idée, je voudrais revenir sur le déficit. Vous dites depuis un certain temps déjà qu'il est trop énorme, que c'est la faute du gouvernement libéral. En même temps, dimanche, on vous a entendu à la télé de Radio-Canada dire que vous auriez dépensé pour aider les Canadiens, vous aussi. Alors, pourriez-vous me dire précisément quel programme qui ont coûté des milliards de dollars, vous n'auriez pas approuvé, parce qu'il y en a un certain nombre que vous avez approuvé, la PCU, la subvention salariale. Alors, qu'est-ce que vous n'auriez pas fait, vous, si vous étiez au pouvoir?
Merci. Comme vous le savez, on a appuyé les programmes d'urgence pendant la pandémie, la prestation canadienne d'urgence, la subvention salariale et d'autres programmes pour les PME. Malheureusement, le gouvernement était lent avec la subvention salariale et à cause de ça, le gouvernement Trudeau a dépensé plus d'argent pour la PCU. Et c'est pourquoi on a un grand déficit maintenant. Plus important, on a besoin d'un plan pour les emplois parce qu'on doit relancer notre économie et après ça, avoir un plan de réduire les dépenses dans une manière équitable. Donc, on a besoin d'un plan pour les Canadiens et Canadiennes pour leur emploi, pour leur bien-être. Et ça serait ma priorité comme chef de l'opposition et comme premier ministre.
Opérateur, prochaine question.
Thank you. Merci. La prochaine question est de Hélène Buzetti. Next question from Hélène Buzetti. Le Devoir. Please go ahead. Your line is open. Votre ligne est ouverte.
Oui, bonjour, Monsieur O'Toole. J'aimerais vous parler de l'aide médicale à mourir. Vos députés sont maintenant les seuls à encore parler sur le projet de loi C7. Ça prolonge le débat et ça compromet le respect de l'échéance fixée par les tribunaux du 18 décembre prochain. Quand on constate surtout que ce sont des pro-vie qui parlent chez vous, des gens qui de toute façon s'opposent à l'aide à mourir, j'aimerais savoir pourquoi vous permettez ça.
Parce que c'est un débat primordial pour notre société. C'est sur l'aide médicale à mourir, l'assistance d'État avec à mourir. Et c'est pourquoi on va continuer de poser des questions pour les plus vulnérables. Et nous sommes avec les autres voix sur ces sept maintenant, les dirigeants autochtones, des médecins, les handicapés. Il y a plusieurs Canadiens avec inquiétude sur ce projet de loi. C'est pourquoi on a proposé des amendements raisonnables pour les plus vulnérables.
Alors, donc, ça risque de faire rater le deadline du 18 décembre. Alors, j'aimerais savoir comment vous voyez ça. Est-ce qu'il faudrait que le gouvernement demande à la Cour une prolongation de délai ou vous êtes capable de vivre avec ce qu'on appelle un vide juridique? Donc, au Québec, le jugement Baudouin s'applique et dans le reste du Canada, on reste statu quo.
Nous sommes en train de travailler avec le gouvernement et les autres partis sur ce projet de loi, mais c'est important d'avoir des protections pour les plus vulnérables. Et c'est plus important d'une timeline d'une cour. C'est une décision très importante pour le bien-être des Canadiens et leurs familles, et c'est pourquoi on va prendre le temps nécessaire pour une approche raisonnable et ciblée sur le bien-être des familles avec les plus vulnérables.
Opérateur, prochaine question.
Thank you. Merci. La prochaine question, the next question is from Cormac McSweeney, City News. Please go ahead. Your line is open. Votre ligne est ouverte.
Yes, as you push for faster vaccines into Canada and vaccinations for the population, your MP, Derek Sloan, has sponsored a petition which describes a COVID vaccine as effectively human experimentation and questions the safety and science of the vaccines being developed. Do you support one of your MPs sponsoring a petition that contradicts your position on vaccines in the worst health crisis in generations? And have you talked to Sloan about this?
You're right, Cormac. This is the worst health crisis in generations, and that's why we need a plan. A plan will actually help provide details and help educate Canadians on the research and approvals of vaccines, how they'll be stored so they can be used effectively, how they can be rolled out first to the most vulnerable and then to other Canadians. This is why information is a tool just as important as rapid tests and vaccines. Canadians are already worried, Cormac. We're hearing through emails, through petitions from thousands of Canadians who have questions, and we have a Trudeau government operating in secrecy. Even the Canadian Armed Forces, it's revealed today, has the same questions that myself and my colleagues have been asking for weeks in Ottawa. So information, I think, will help bring certainty to a lot of Canadians as a result of not just pandemic response closures, but also the efficacy of the vaccine.
This is not just about, timelines. This is describing the vaccine as effectively human experimentation. So there is a difference in the information. But I will ask again, do you support an MP presenting a petition like this? Have you talked to Sloan about this? And are there going to be any consequences at all?
Well, we had caucus yesterday, and we talk as a team every week. And I think, Cormac, more important than petitions sent in from Canadians across the country is a plan for the 38 million Canadians seeing a government with no information heading into Christmas at a time we're going to be seeing millions of other people around the world receiving the vaccine. You wonder why there are questions? Because we have a government that has been wrong on masks, wrong on human-to-human transmission, slow on all responses, partnering with China, and not answering basic questions like, do we have freezers ordered for the vaccine? You wonder why Canadians are worried? It's the secrecy and incompetence of the Trudeau government.
We'll now take questions in the room. Nous allons maintenant prendre les questions dans la salle.
Yeah, good morning, Mr. O'Toole. Ryan Hamilton, National Post. You're asking for a detailed plan for all of the vaccines the government has ordered. Some of those vaccines haven't finished clinical trials. Most of them haven't submitted regulatory documents to Health Canada, or none of them have been approved. Do you think it's a little hard for the government to provide specific details on a rollout plan on vaccines that haven't met approval yet?
No, Ryan, because we're asking the same questions that I've learned the military are now asking. Mr. Trudeau used the military last week as a prop in a press conference. They were giving no plan with respect to distribution across one of the most vast countries in the world. And so if for some of the vaccines they don't have an exact date, they could do date +1, date +2. That's how any business plans, that's how the military plans, that's how charities and nonprofits plan. Why should the federal government not reveal their plan?
You just said that the Prime Minister used the military as a prop in a press conference last week. Do you not think General Fortin should be part of this rollout?
General Fortin is a spectacular Canadian leader. As a veteran myself, I'm very proud of the Canadian Armed Forces. And I wasn't surprised to see the top general write the Prime Minister asking the same questions that we've been asking for weeks in the House. The Trudeau Liberals, through their secrecies, through their lack of coherence and clarity, are not only setting up the military to fail, they're setting up the provinces to fail. The only group negotiating with the vaccine manufacturers, getting ready for distribution, making sure the vaccine can be stored safely, has been the federal government. Why the secrecy? We need to make sure that provinces, the military are ready. We need to make sure Canadians have the peace of mind that we have a plan in place for whenever the vaccines arrive. I can go online and see plans from other countries. I want that same transparency for Canadians.
David?
Hi, good morning, everyone. Thanks for meeting with us this early morning. I had a question for MP Michelle Rempel Garner about the situation that's happening in Alberta. Basically, the question is this. What does it say to you that your province is requesting this assistance from the federal government? What does it say about the COVID-19 situation that's happening in Alberta?
My community has been hit particularly hard by the pandemic for a variety of reasons. And this is why today in the House of Commons, we are requesting the government to provide more information on the tools that they intend to provide the provinces to get us through this crisis. there are so many people in my province that are struggling both with COVID-19, but also with the mental health issues of sustained unemployment that I think has been exacerbated by the Trudeau government's policies. What we are here to do is to encourage the federal government strongly to provide information, to provide rapid tests, and to provide a plan for vaccines so that we can have certainty moving forward.
Okay. So clearly, the situation shows that Alberta is having a difficult time, as you said. What does the situation say about how the Jason Kenney government is managing the situation?
I think from coast to coast in this country, we have 37 plus million Canadians who have struggled with 11 long months of this pandemic. And in order for our country to have certainty, we need to have the information that we're asking from the government today, particularly when it comes to vaccines. I want to thank every provincial government, regardless of political stripe, their health officials, first responders who have been working so hard during this. But I think everybody, what is uniting this country across political stripe, across jurisdiction, is we need to have a way out. We need to have a clear plan that comes with information on the vaccine rollout, rapid tests, and better public health data so that Canadians can understand when they can get back to work and when they can see their loved ones.
And last question, dernière question, Madeleine.
Bonjour, Monsieur O'Toole, Madeleine Blais-Morin de Radio-Canada. Comment pouvez-vous espérer que le gouvernement va vous donner la date de déploiement des vaccins s'ils ne sont pas encore autorisés par Santé Canada?
C'est une question importante et c'est pourquoi peut-être pas une date spécifique, mais si on a un vaccin spécifique en février, par exemple, quel est le plan après ça? Immédiatement, est-ce qu'on a des congélateurs nécessaires pour le vaccin de Pfizer, par exemple? Quel est le plan pour les communautés rurales? Quel est le plan pour les communautés autochtones? Et quel est le plan spécifique pour nos forces armées? J'ai la même question de General Vance sur le vaccin, sur la distribution. Et c'est pourquoi on a besoin des dates, mais sans date, c'est possible d'avoir un plan pour les actions immédiatement après la décision de Santé Canada.
Je me demandais si vous étiez à l'aise avec le fait que votre député, M. Sloan, dépose une pétition qui dit que le processus actuel correspond à de l'expérimentation humaine.
Il y a beaucoup d'incertitudes à travers le pays maintenant. En pleine pandémie, nos citoyens ont des questions spécifiques sur le vaccin, sur les programmes. Et c'est pourquoi on a besoin d'informations. On a besoin d'un plan pour la confiance de nos citoyens pendant une pandémie. Avec un plan, on va éduquer sur le vaccin, sur le plan. Et c'est important, le vaccin, les tests rapides, information sont les outils importants pendant la pandémie. C'est pourquoi on va continuer de poser des questions chaque jour. C'est pourquoi on a la motion aujourd'hui. Les Canadiens méritent un plan avant Noël.
Merci, c'est tout le temps qu'on avait. This concludes the press conference. This is all the time we have. Thank you.
Merci beaucoup.